Hi, this is Dr. Chilakamari from Atlanta. He is a psychiatrist and would like to introduce himself, and then we will go ahead with our questions in context of coronavirus and lockdown. Doctor, can you introduce yourself, please?
Sure. My name is Jagan Chilakamari. I'm a child, adolescent, and adult psychiatrist. I'm in private practice in Boswell for the past 15 years. The place I practice is known as Atlanta Psychiatric Institute. And in addition to that, I do a Tourette's clinic once a month at Emory Neurology, and the clinic is known as the movement disorder clinic with a neurologist, a very competent neurologist. I do a combined clinic for Tourette's syndrome and other movement disorders in children. Our clinic is a unique clinic in the sense that this is the only clinic where a psychiatrist and a neurologist see the patient at the same time. So we have recently presented a full course at Academy of Adolescent and Child Adolescent Psychiatry for about 2 hours about recognizing the commonly occurring movement disorders in children in psychiatry and how to evaluate them.
What kind of patients do you see in your practice, doctor?
I see a variety of patients in my practice, but I usually get referred much more complex patients than usual. My patients have a significant different medical, psychiatric, neurological comorbidities such as the seizures, head injury, birth defects, and congenital malformations or genetic syndromes, in addition to complex psychiatric conditions such as bipolar, autism, mood, and regulation issues, etc., etc. So in general, I have a practice of complex patients, and I also provide second opinions to my colleagues some other times when they have a complex patient.
So we're going to start today with virus lockdown questions, and that related to your practice too. So the questions are from a grade school student.
Hello, Dr. Chilakamari. I have some questions for you here today. My first question, based on the coronavirus, is what is a virus?
A virus is a non-living organism. It only becomes active only when it finds the host cell, which is typically an animal, or it could be a human. So unless they get replicated in a human or a host, they're not active. So otherwise they are non-living organisms.
How long do you quarantine after coming in contact with someone with the virus?
Typically at this point of time, according to the CDC guidelines, it is 2 weeks. After the 2 weeks, usually what they are doing is they are doing a retest to make sure that they do not have COVID-19 anymore. And once the test is negative, they are welcome to return to their life.
Was there any other virus that spread as fast or any that was this lethal?
Actually, COVID-19 is not a rapidly spreading virus. It's, as a matter of fact, it has a long incubation period. But the COVID-19, prior to that, there is another COVID, which is known as the SARS-1, which is basically initiated also in China, has been much more lethal than this one. And of course, Ebola is another virus that is also very lethal. So COVID-19 is more serious because of the reason is that it has a longer incubation period and followed by a significant risk of infecting older and vulnerable population who are immunocompromised and causing them to have a serious disease.
Are there any medicines of your knowledge that stop a similar virus or maybe corona?
At this point of time, there is several different medication trials are happening. At this point, conclusively, there is no known treatment other than symptomatic.
Why should people do 6 feet distancing? What does it help?
The purpose of this 6 feet distancing is that when you cough, the chance of the virus particles, every time when you cough or sneeze, you probably will be spreading about 3,000 virus particles, and these have a chance of spreading up to 6 feet. There is basically consideration that it could be even longer based on the situation the patient is in. So the 6 feet distancing is to avoid the spread of the virus particles because they are not visible in the air.
Okay, now we will change over to coronavirus questions regarding your field. Okay, my first question is, are anxiety cases rising due to the coronavirus?
Absolutely. I think there is a lot of uncertainty about the risk of getting infected, and there is also anxiety about whenever people are going out to buy groceries in other places, despite they may be properly wearing the masks and using the Clorox and the hand sanitizers. However, a lot of vulnerable population will have increased anxiety because of the uncertainty of other symptoms, like if they're developing a cough, sneeze, or anything because of the allergies or any other condition, the fear of that, could it be a COVID-19, because we do not have the testing available at this point, and there is a lot of uncertain, unclear information available in the market.
Okay, my next question is, are behavior varying when people stay inside? As you know, in many countries there's a lockdown and they have to stay home and not go outside. And do you think behavior is changing due to that?
It is helping some people, but it's also causing a significant amount of restlessness in many people. And the reason for the restlessness is because of people don't know what to expect, when to expect. And when people don't know, as a human, when we know what to expect, we have a certain level of reassurance in ourselves about how to manage our behaviors. But when there is a lot of limbo when we don't know what to expect, then it inherently increases our level of impatience and anxiety about what to do next. And these kind of things are creating a significant amount of anxiety. And in long run, because of the COVID-19, we will be practicing much more hygiene, and definitely the social distancing will become somewhat of a norm in future, which is not a bad idea. But the question is, at this point of time, a lot of things are in limbo, and that is the biggest stressors for many people.
As you talked about the anxiety cases rising in our other question, do you think, based on the anxiety, more panic attacks will happen? They'll get super scared?
There is always a vulnerable population that there is increased risk for developing the panic attacks and the super anxiety, you call it, like more of an anxiety attacks. But in general, population have a slightly increased risk for having anxiety, but usually panic is a bit of an extreme, but those can happen depending on the stress and other things that are happening in their life. So not everybody is going to have panic attacks just because they're anxious.
Okay, my next question is, as you know, in the lockdown, as they're staying home, more and more kids and adults are on their devices, maybe playing video games, watching TV, doing hardcore work. But do the devices change behavior in the people in any way?
So devices don't change the behavior. I think the criticality we need to understand is some people are more vulnerable to the device addiction and device related anxieties and anger problems compared to other people.
So basically, like on their devices, they can see the news, and then there's some alarming news on their devices. How does that change their behavior?
Well, I think the question basically is any news in excess is going to be a problem. Important thing is when we're watching the news that is more neutral and more informative, that will actually reduce the anxiety. However, when we are watching a news that basically is a lot of uncertainty, there is a lot of write-ups about deaths, dying, lack of care, a lot of access to care, things that basically keep us in limbo or in uncertainty will increase our anxiety. So the criticality is I think the more we can choose a very reliable source to get our appropriate medical information and economic information and things happening in the world in those channels, we have a better chance. But if we're relying on certain channels that are more biased towards one versus the other, we are definitely increasing not only our anxiety but our stress levels, and that can lead to a significant mental health problems later on.
Yeah. Anyways, as you know, there is ADD and ADHD. Are kids more hyper due to lockdown, or are they still the same?
The question is that it's a tricky question because of the reason is the ADHD has nothing to do with whether you're restricted and unrestricted. However, the point is when kids get bored because they have less access to more activities and more people to play with and other things, they have a tendency to their symptoms can get exacerbated. So certainly these kind of situations where they're being locked down in the home for longer periods and not able to go to the school and other things certainly can exacerbate their symptoms.
Oh, okay. Okay, so are more people getting depressed due to maybe their family getting corona, maybe their relatives getting corona? Are you seeing more cases in your office of depression?
So there is definitely increase in the depressive symptoms. There is a difference between the depressive symptoms and having a full-blown depressive episodes. Especially when people lose their loved ones, and lots of the people who have friends and families who have COVID-19 positive cases, definitely there is a significantly increased risk of them either clinically or subclinically becoming depressed and anxious and somewhat more feeling helpless. The sad part of this particular illness is there is a significant amount of helplessness on the part of their families and friends because they cannot go see them and support them and help them. So because these patients needs to be in quarantine and isolate themselves from their loved ones, that can increase their sense of despair, and this can lead to long-term consequences which we have no awareness at this point. But in a short term, definitely there is a lot of grieving, a lot of the question of mourning, and lots of other things that basically we call it usually we see as a reaction to loss of the loved ones. So those reactions and everything else probably would be more exacerbated.
Thank you, Dr. Chilkumar, for your answers today. They're very informative based on your field and based on the coronavirus. That's it for today. Thank you, Dr. Chilkumar.
Thank you so much. Appreciate it.
We'll see you guys again later.